Good afternoon, everybody. My name is Tara Bruce, and we are coming to you live from the Core at Law in Cantata. Thank you so much to those of you who are registered to participate in our live stream lecture today. If you're just logging on to Facebook or YouTube and joining us, we are getting ready to start our pregnancy and postpartum depression lecture as a part of our Women's Health Month here at the Core. A couple things just so you as a live stream audience can get the most out of your experience. Do know that we have a team here that are tracking on your questions. So we hope that if things come up in the slides as we talk about this with our small in-person audience here as well, that you feel comfortable to type those in and know that we'll make sure to get those questions to our presenter so we can get those answered for you as well. At any given time you have issues with audio or anything that you're not seeing correctly, let us know and we'll do our best to troubleshoot our technology here and make sure that you have the same experience that our in-person audience is having as well. Again, for those of you just logging on, this is our pregnancy and postpartum depression lecture coming to you live from the Core at Law in Cantata. Keep those questions coming and we look forward to sharing what we know today. Thank you, Allison, come on up.
Thank you so much. Good afternoon, everyone. Thank you so much for joining us, both here at La Cantata and also online. I really feel passionate about this topic. I am a staff psychiatrist at Palo Verde and also at Tucson Medical Center, but I also have specialized experience working with women in pregnancy dealing with depression and also in the postpartum period. And I think it's often a time that, the focus is so much on the baby that sometimes, the mom's health gets missed. And so it's always important to kind of refocus on mom and make sure that you have the information to understand if something is going on that can be helped to improve your quality of life and also so that you can be present for baby and for your whole family. So I really want this to be kind of an informal dialogue, so please feel free to bring your questions. I want this to just be an opportunity for you to explore and make sure that you're aware about what postpartum depression is, what depression in pregnancy looks like, what anxiety in pregnancy looks like, and what the treatment options are. So that's kind of the framework for today. And just a little bit about my background. So I am new to Tucson. I did most of my training in the Midwest. So I did undergrad at Case Western Reserve, and then I did my medical training at one of the Ohio State universities, Neomed, and then my psychiatry training at WashU in St. Louis. And then for a myriad of reasons, I ended up in Tucson and am on the staff at Palo Verde and also at Tucson Medical Center where I do consults. So thank you all for being here. And then sometime in the mix, I did have a baby when I was in residency, so that's Ari. And then Daniel was born in 2020. So I have understanding about what it means to kind of go through the experience and can share some experiences that really shaped how my clinical practice and just understanding about the treatment options moving forward. So depression is very common in pregnancy and postpartum. And I think it can be challenging because often when you're going through it, it feels like you're very isolated and alone. And it's hard to really have that concept that maybe other people are dealing with similar symptoms. And I think especially during the postpartum period, when the focus is on, baby so much that, screening mom for postpartum depression isn't always at the top of everyone's list. And even, thinking about how to care for baby, kind of going through all the transitions with hormones, there's so many symptoms that happen during pregnancy and postpartum that it really becomes nebulous. What is normal? What isn't normal? So really, most of the studies about depression in pregnancy, occurred before COVID. And the prevalence was about 15% during pregnancy, and then about 10 to 20% about similar for postpartum depression. And now with research through COVID and the pandemic, those numbers are just going up and up because support, for family support is down. There's a lot more uncertainty. And so there's been big kind of studies across different countries where it's been shown that rates of depression can get up to 40% or more in different countries for the postpartum period. So that's a pretty sizable number of people that are dealing with this illness, and then thinking about who's actually getting treatment for this, right? So I don't know if anyone here has heard about the baby blues. I've thought through what that is. So let's see if we can. So baby blues, so kind of when you're going through kind of postpartum, those first few weeks, no one's getting any sleep. Appetite's all over the place. Maybe more irritable because, you're only sleeping a few hours here or there. Your sex drive might be non-existent. And so all of these symptoms are like, well, is this actually depression or is this normal pregnancy? So when is it postpartum blues? So that's really it really is a self-limited process. So it usually resolves about 2 weeks postpartum. And it's really, you're having this sleep deprivation, kind of mood swings. You might be more reactive. Someone might, ask you to do something, and then you're like having just an intense emotional, tearful episode. And you're like, how did that happen? You might be feeling really overwhelmed, especially with baby number one, how do I even do this? Am I cut out to be a mom? Having those sort of questions running through your mind. And also anxiety about whether baby's getting enough milk. And I think, especially for moms that are trying out breastfeeding, I think that can be a really challenging a period where, lactation counselors are, wonderful. But then once you get home, you're like, well, what am I doing? And then, baby's crying and you're like, am I just a failure at being a mom? Because, baby's still crying and I just fed him 10 minutes ago. What's going on? So generally about 2 weeks, this sort of postpartum blues will start to fade. But when it doesn't, that's when you start looking into, could there be a postpartum depression going on? And obviously the 2 weeks is not, set in stone. I mean, sometimes the postpartum blues can last a little bit longer, but I think when it starts to really interfere with how you're interacting with baby, when that irritability is kind of persisting through those first few months, or even, even after, or even, some women will be, totally fine those first few weeks. And then, several months later, or even 6 months later, they start developing more depressive symptoms, like just not feeling adequate at parenting, not having energy or motivation, not getting pleasure in kind of activities. So, going for walks and kind of, doing kind of normal hobbies that maybe were very interesting before having a baby, they're just no longer interesting. And also those crying spells. I think sometimes the anger is really a prominent symptom, just feeling really frustrated all the time. And then sometimes this whole syndrome can occur with suicidal thinking, just feeling like life isn't worth living. And when it gets to that extreme, that's when you're thinking about, okay, is this postpartum depression? And really getting screened for that. I will say that, even as a psychiatrist and kind of going through 2 pregnancies, and it wasn't routine that I was getting screened. So, and I thought this was really interesting because I really wanted someone to ask me, how are you doing, and do the, the questionnaire to really screen for me. And the only time that it really happened was at the pediatrician's office. So I just think that's interesting because, and maybe that's, they're like, oh, you're a psychiatrist, you must have this all under control. But it's, it's a human experience. And so it can really, the symptoms can really feel like you're not sure, is this just normal pregnancy, or has it gone to a different level? Is it something that, is really interfering with my functioning? And I don't know if anyone here has had any experiences where, you just weren't sure, or if there are symptoms that, you thought about where like, is this normal, or not sure what to make of this, but feel free to ask questions and we can kind of come back to it or get to it now. And really as I said, the symptoms can happen anytime, during that first year postpartum. So sometimes it can really sneak up on folks, like they can be, 6 months out or 9 months out, and then all of a sudden they're starting to get symptoms of depression. And certainly there's, mild forms and then it gets to moderate and severe. And when you're getting to the, moderate or severe, that's really when, you want to get specialty attention and make, especially if you're having suicidal thinking. When it gets to that level, that's when you really want to get help and reach out. And we'll get to some of those resources towards the end about what to do in that situation. So perinatal anxiety, this is also very common. So pregnancy anxiety, so this is a pretty universal experience, concerns about baby's health, delivery, what to do, caring for baby after you go home, the financial implications, the possibility of, just things not going right. And there's a lot of in focus on, pressure on mom, on what they're doing. Like, are you exercising enough? Are you eating the right things? Are you taking the right vitamins? And all these things can put a lot of pressure. And then, when it becomes a problem is really when it starts interfering with your functioning. So if it's, you're not able to get out of bed, you're not able to take care of yourself, you're not eating, you're not able to, do those sort of basic routines of your life, caring for the people in your life. That's when you want to get help with that. And I think what really scares a lot of moms is these kind of intrusive thoughts. So there's a lot of research about this, and there's one study I saw that's just like a completely universal thing, like up to 100% of new moms are having these intrusive thoughts. So what if I fall down the stairs and something horrible happens, and I drop the baby? This is a pretty universal experience. Now, sometimes, you're having, up to 50% of those moms too may have thoughts of maybe I'm going to harm the baby, right? Like I'm going to, I'm going to intentionally do something that's going to be harmful. And I think that's really when it starts getting difficult, because you're if you have all these intrusive thoughts that you can't put aside, and it's not something that you have control over, then that can interfere just with your coping and kind of and adapting to that new role as a parent. And really the compulsions are what happens to kind of neutralize those thoughts. So if you're having, I certainly remember, like, we had big stairs before we moved to Arizona and everything's on one level, but in St. Louis, we had, big stairs. And I remember I was like in the middle of the night, trying to go in the stair. I'm like, what is going to happen? Am I going to, something horrible going to happen? To the point that, sometimes I would just give the baby to, my husband or, another family member if I was having those thoughts. And then sometimes the compulsions would be kind of checking on the baby throughout the night. Did I put the sleep sack on too tight? Did I put too many blankets in? Did I leave a blanket in there? Kind of checking, and you never trust the monitor. The monitor could be lying, right? So and most women that have the intrusive thoughts, you're like, oh gosh, do I have OCD? But most women don't have OCD. It's just it's a very common phenomenon, and it is associated with kind of the anxiety and depressive disorders in pregnancy. Questions are? Okay. So why are all these shifts happening during pregnancy? This is actually just a chart that I took from Wikipedia, and it just shows that there's so many hormonal fluctuations that occur both during pregnancy, and then you can see towards that PP at the bottom over there. Let's see if I can, that just shows that just immediately postpartum, you're having like major drops in the estradiol, and also just progesterone and all the kind of pregnancy hormones that are supporting baby in utero are just like completely plummeting. Now, some women, and it's great, you kind of go through and they're totally not sensitive to any of this at all. And it's wonderful. And some people are, and it's very, very common to be sensitive to these fluctuations. And I will get to kind of that's really what spurred a lot of new research and medications for postpartum depression, because the mechanism really is different from other types of depression. So you think about, these hormonal shifts, that's not happening in depression that's occurring in the elderly, or that's occurring in other periods of life. This is a really unique period. And so that really spurred a lot of research into new therapeutics. And we're going to talk about that because that's the really exciting moment, because this is, for the first time, we do have an FDA-approved medication for postpartum depression specifically. So what are some risk factors? So what, there are things that, if you're going through all of the hormonal fluctuations, what are some other risk factors that you might develop a postpartum anxiety or, anxiety or depressive disorder during pregnancy? So some of the bigger risk factors are if you have a personal history of depression or anxiety, either you've been treated or you've gone through therapy in the past. So I think a lot of the, literature historically in pregnancy is like, it's a very, happy experience for everybody. And, it's like all roses all the time. And you sort of, especially with the first baby, you sort of think that kind of going through like, that you're sort of immune from having, mood problems or changes, or maybe you're going to just be, the mood changes will be for the better. And I think a lot of research has shown that it's actually a really vulnerable time for women, is that pregnancy, postpartum, period. So if you've had a personal history of a mood disorder in the past, you have an increased likelihood of having a recurrence during pregnancy or postpartum. And also, if you've had a family history, with mom or a grandmother has had postpartum depression, then it also increases your risk personally for experiencing that. And with COVID, with the newer research showing increased rates, prevalence of postpartum depression, and since 2020, it's really that limited social support that can play a major role. And I remember, I think Daniel was born, July of 2020. So that was a real shock because no one was there. So, there were so many unknowns. And I also had another toddler kind of running around, and, you feel really kind of helpless. Like what is there, what's there to do at home when it's just, you're just by yourself. And the typical kind of supports that you'd have before the pandemic really weren't there. So programs like this are wonderful, but I think especially, in the early stages of the pandemic, those weren't available as much. And we'll talk about, some other kind of resources out there. But, for me specifically, like getting a doula, things like that were really helpful, just to boost that social support. Because I think knowing the vulnerabilities, that was a major factor. Also conflict, with partners. So oftentimes the stress of kind of becoming a new parent or, adding another child to the family, that can lead to a lot of conflict in relationships. And, not having a way to kind of work through that can definitely increase your risk for feeling a lot of guilt and blame and kind of fueling the depressive or anxiety disorders. And also having more children can also be a risk factor. So let's see. So when you're experiencing a mood disorder, be it depression or anxiety during pregnancy, we are learning that it's not a benign, it's not a harmless sort of process. So it not only has risks for mom, but it also has risks for baby. So there's new research showing that when mood disorders aren't treated during pregnancy, it can increase risk for developmental issues with baby down the road, and also can impair your ability to kind of bond with baby after baby's born. And then in terms of the pregnancy, also increasing risks for low birth weight and prematurity. So just more reasons to kind of recognize the symptoms in yourself and making sure you're getting help so that you can stay on top of it. And, so just a cap too is when those disorders are treated, right, it does make a big difference. So it's just then help is available and just understanding where to go and how to make sure you have the right resources. So this is one of the primary scales that's used. You might have seen this in your OB/GYN office or your pediatrician office. It's the Edinburgh Postnatal Depression Scale. So this is one of the primary ways that your doctor will screen for postpartum depression. It's a validated metric, so it has it's reliable. The results are reproducible, across different populations. So it's I don't know if you've had any experience with this, but basically if you're scoring higher on this, it just is a red flag, right, for the doctor to say, hey, look, I'm going to refer, this mom to get additional evaluation or support, make sure that they're getting treatment if needed. So I don't know if any of these questions you can see clearly, but, just looking forward to, with enjoyment to things, being able to laugh and see the funny side of things, blaming myself unnecessarily when things go wrong, feeling scared or panicky. I don't know if any of you might identify with any of these types of symptoms. I certainly had some of those when I was going through, for sure. And then the last question, that the doctor is going to look at, most closely is, you're having thoughts of harming yourself? And obviously that's an emergency. You want to make sure that you're getting help with that. So what are some self-care tools? So maybe you've taken this questionnaire and it's come up, well, you're kind of, you're at risk for having a depressive disorder or an anxiety disorder. Maybe you're recognizing it in yourself and or you have a family history or personal history of depression, anxiety, and you want to stay on top of it and see how, if you can prevent it from getting worse or from happening in the first place. So the first step would be really kind of rallying up support. So, especially with the pandemic, it's, the doula can be really great. I don't know if any of you have used a doula, but I had a really great experience with one myself. And then making sure that you have, any family or friends that can be around you. And if it's, coming to a place like the core, if it's, finding, other moms that are, going through a similar experience, if it's, longtime friends that you can rekindle a relationship, and then making sure, your partner, understands what you're dealing with in terms of what support you need. The exercise, kind of nutrition, just making sure that you're feeling good in your body. And then there's good research about acupuncture and massage, bright light therapy. So you can actually get these lamps on Amazon, but you have to be really careful that it's like actually 10,000 lux, because that does make a difference. And there's a lot of other lamps out there, so just be real careful. And then I think postpartum, I don't know how routine it is here in Tucson, but the pelvic physical therapy can be really helpful. I think that can be a big trigger for some patients, is the physical change after having a baby, whether it's a C-section, whether it's a vaginal delivery. A lot of changes happen. It can be really bewildering. And there's not a whole lot of support for that. And you're sort of just expected to kind of deal with it and move on. But really it can be shocking. And there's, and the pelvic physical therapy is wonderful. So definitely if you haven't done that before, go check it out. There are a lot of different wonderful therapists in town who specialize in this, and are a great resource. And I think in a lot of other countries, it's actually just it's insurance is sort of built in, and then you have your pelvic physical therapy appointment after your delivery, and maybe a couple. I think it's 4. So definitely do that. And then, so you've gotten to this point where, you want to get help. You've recognized you have some degree of depression or anxiety that's impairing. You want to get a handle on it. One of the primary kind of therapy approaches that's kind of the first line, especially during pregnancy, is if you want to try to get psychotherapy to help with your depression or anxiety, CBT is really the first line that you'll see in the community. So if you're researching different therapists, cognitive behavioral therapy, that is the most evidence-based for treating depression and anxiety in pregnancy. And the premise really is that your brain is a big muscle, and when you have depression or anxiety, it really kind of trains that muscle to kind of be overwhelmed with a lot of kind of negative thinking. And when as your brain is a muscle, it's coming up with thousands and thousands and thousands of thoughts every day. And how many of those thoughts do you think are really kind of high quality thoughts? A lot of it is just sort of a reflex, and not really thought out too well. So you might have thoughts like, gosh, I'm a failure, or I can't do anything right. There's a lot of basically cognitive errors that will happen, especially with depression, where you maybe will focus on something, maybe happened during the day that, you spilled the bottle, and, you're concerned about your ability as a mother. Like all of a sudden, something happened, you spilled something, right? And obviously it's frustrating, but then somehow your whole day is now kind of overwhelmed with thoughts like, I'm a failure. I'm not cut out to be a mom. So those are the types of cognitive errors that might happen with depression. And the cognitive behavioral therapy really helps to identify those kind of thought changes that are occurring, and really helping to not only help you identify it, but also kind of correct it. So basically kind of that a thought is not a fact. And that's the real kind of premise of the cognitive behavioral therapy, because a lot of times you're having a thought and you're like, this must be real, right? All these, it must be the truth. But the therapy element is really, your brain is a muscle. It's coming up with thousands and hundreds of thousands of thoughts a day, millions of thoughts, right? And how many of those are really high quality? And then when you're having a thought that's negative, it really impacts your mood too. So you might notice, if you're having a thought like, I'm not cut out to be a mom today, or I'm not cut out to be a mom at all, that might be kind of fueling feelings of depression, might be fueling, sleep disturbance, might be fueling appetite disturbance, it might be fueling like how you're interacting with baby, how you're acting or interacting with other people in your life. And then another really helpful therapy for postpartum depression specifically is called interpersonal therapy. So the premise of this therapy, which I think is great, is obviously all depression kind of starts in the brain, and it is very biological, but it also occurs in a context of psychosocial interactions. So that means, relationships, that means transitions. So, pregnancy and, postpartum, you're going through a major role transition, becoming a mom of, maybe one, maybe one of two or multiple. This is a major change. It also can lead to challenges with relationships, as I mentioned before, that kind of role, just conflict, right, with other people in your life. And then there's also kind of a grief too that can happen. I mean, there's so many, maybe it's loss, maybe it's, the pregnancy didn't go as planned. I think a lot of people kind of have a birth plan and things go completely different, right? And there's that loss of like, how come things didn't go the way that I thought? There's so many changes that happen kind of in your body, or just with a previous role that doesn't exist anymore. It's like your life without, baby is just totally different, before that pregnancy and after the pregnancy. So this is kind of one of the approaches that the interpersonal therapy will kind of look specifically at, is understanding kind of that role transition, becoming a parent. So establishing a more realistic view of what that entails. So, maybe you've had friends that have, had babies and this is your first time, or, maybe you think you have it all under control, and then all of a sudden you have a new kid and you're like, what is going on? And also kind of identifying what those notions are of life before kids. I think once you're in that mode of, I'm not getting sleep, my body's completely changed, I'm irritable, you kind of have this idealized notion of my life, before I was pregnant, when you were kind of able to go out and not be, feel like you have another life dependent on you now, or your whole body has changed and you've kind of dealt with this whole trauma. And kind of just moving through that, kind of mourning the loss of that old role, and developing strategies for coping with the new role. So that's kind of what we talked about, is making sure you've got the support, making sure you're doing self-care, and kind of learning kind of new skills to help you through. Yeah.
Has there been any studies or information on how social media has been impacting the views of what being a parent should look like, and that's positive, negative?
Yeah. When I was at WashU, I was involved in some research on social media, just in terms of influencing depression and kind of substance use. I'm not familiar about it with pregnancy specifically, but I know in general with depression that there are a lot of, specific kind of groups and, Reddit and, different media platforms where it can really kind of channel a specific way of thinking about pregnancy and what the postpartum experience is. So that's a great question. If I have any references for you, I'll definitely share with those with you later. Yeah, thank you for bringing that up. And then another kind of role that kind of gets addressed with the interpersonal therapy would be kind of role disputes. So that could be with kind of anyone in your life. It could be, your partner, it could be someone close to you, a friend, just different expectations about responsibilities surrounding newborn care can be a big trigger for folks. In terms of feeding the baby or getting up at night, all of these things where, you're recognizing that you need something and that need is not being met, or you feel like you're having trouble communicating what those needs are, or just having an understanding about your needs and baby's needs, right? And then a therapeutic approach is just, really understanding what the nature of the conflict is. So there's going to be some sort of communication issue that's going on, and then developing, skills to communicate and work through that and resolve that dispute. Because oftentimes that can be really triggering and making kind of depression or anxiety worse. And we talked about grief. I think the medical complications, miscarriage, or loss are things that really don't get talked about on social media or anything as much. And I think the focus could be so much on baby and not much on the myriad of things that can go wrong. And I think that sense of loss is really powerful. Even if everything goes perfectly, there's always some sort of grief. I think in terms of, you're no longer pregnant. Sometimes there's just a grief you're no longer pregnant. But I think with, everybody's got some sort of story. I think even no matter, if you have it planned out, 100%, you have your birth plan, perfectly spelled out, not everything is going to be going 100% the way that you think. I think when kind of coming to terms with that can be really important. And I think, in my case, I had an induction for my first baby. It was like a 39-week induction, and it was like I think I was like 24 hours, maybe, yeah, it was like 4 hours of pushing, and then they were like, you can keep going. And I was like, I'm exhausted. I don't think I can keep going anymore. I was like, cut the baby out now. But those are the experience where, afterwards, I'm like, I'm completely exhausted. This has been a trauma, and then all the focus is on baby. And then all of a sudden, you're at home and you're a new parent, and you're kind of having to navigate, and it's just a completely human kind of experience, but the resources really aren't there to not only identify it, but also support you with that. And then Daniel, he was, there was like the pandemic was there. So there's just so many things going on. And I just kudos to all of you guys, going through this during the pandemic, and, everything is really unknown, and, and just trying to kind of carve out a path and in that uncertainty is really remarkable. So let's see. And really the IPT approach to kind of approaching kind of the grief and loss is really kind of boosting social support, as we talked about, and doing some just well-being and specific interventions like mindfulness, visualization, kind of grounding exercises. And if any of you are interested in that, I can give you more resources on that at the end. So this is a really exciting time in kind of the medical innovation world, because we finally have an FDA-approved medication for postpartum depression. It's called brexanolone. And I was actually a part of the team at WashU that was working with women who were getting this medication when it first came out. And so I was able to see kind of how it works firsthand, and it was really remarkable. So I think with a lot of the pre-existing medications and approaches to treating depression, it can take a long time. And I think that can be really frustrating when you're dealing with a crisis and you're dealing with really debilitating symptoms, and to be told, okay, you're going to start therapy, you're going to start this medication, but the results might not be seen for several weeks. So finally, now we have a medication called brexanolone. So this really targets that hormonal fluctuation in that postpartum period, where I remember that Wikipedia graph where it showed that like in the postpartum period, all of those neurosteroids are just plummeting. So this is actually a neurosteroid infusion. And it is a little bit difficult to manage in the sense that it is 60 hours. It is an outpatient procedure, but you have to be hooked up to an IV for that period of time. And they're basically just monitoring your oxygen level with a pulse ox machine on your finger. And but it does lead to rapid symptom relief, especially for the moderate to severe depression. So if you're having symptoms that are consistent with kind of a moderate severe depression, definitely talk with your doctor about this medication. One thing to just be a note about this is that if you are breastfeeding, that you're not going to want to continue to breastfeed during the infusion. You would kind of pump and dump, as they say, but then you can continue to breastfeed once the infusion is over. It's not going to be like you have to stop breastfeeding forever. Any questions about that? Oh yeah, we are, Tucson Emergency Room is doing this infusion. So if any of you are interested, they do this in town, and we're trying to expand access at Palo Verde and Tucson Medical Center as well. So just keep on the lookout for just expanded access to this really important treatment. So medications during pregnancy. So when you're, especially like in pregnancy, there's a lot of, questions about what is safe, what can you take and what's going to be the impact on baby. So the SSRIs are kind of the big category of medication that's been studied for a long time in moms. Obviously, the literature in pregnancy is just more limited than other types of other patient populations, because it is just so challenging to try something new in pregnancy. But these medications have been around for a long time. These are medications like Zoloft, Prozac, and they work by kind of boosting neurotransmitters in the brain that are involved in depression and anxiety. So I think, especially on social media, there can be a lot of kind of blanket sort of concerns, like, just about, what are the risks? And you really want to be careful and make sure you're talking to your doctor about the specific kind of indications and what the risks are. But what we know from research is that, overall, the major concerns that folks have about, birth defects and complications is that the Zolofts and Prozacs of the world are safe. There is no significant association with any birth defects above baseline. There are specific kind of medications that we try to avoid because there have been some increased risks. So like Paxil is one you'd want to avoid, Effexor you want to avoid. But in general, like the Zoloft and Prozac are used very routinely, and they are safe. The one thing to think about is that there's a very rare vascular disorder, and it's very rare in the general population. And then there was some study that showed that there may be a marginally increased risk of having this pulmonary hypertension of the newborn. But it's very questionable. There were a lot of different factors in the study that could have accounted for the results. So I think in general, it's not something to worry about, but definitely talk with your doctor if you are concerned about that. And also kind of balancing the risks and benefits. So if your depression or anxiety is severe, moderate to severe to the point that you are seeking treatment, and you should seek treatment, right? If you're trying to discontinue, medication before you get pregnant or during pregnancy, you are at significantly increased risk for having a mood episode during pregnancy. And we talked about, what the risks are of a mood episode in pregnancy when it's untreated, right? Is that it's going to increase, complications for the pregnancy, and then also for the baby postpartum. So just something to keep in mind about. And then I think a lot of the concerns that I've had from patients about medications during pregnancy is really this neonatal adaptation syndrome. So this can occur in about 30% of babies who are exposed to the Zoloft type of medications during pregnancy. It's very harmless. It lasts about 1 to 4 days. It might include, the baby's more irritable. They might not be feeding as well. They may have some increased muscle tone, but it does go away. Doesn't cause any long-term harm to baby. And in general, the increased risk for this is going to be if you're taking kind of the Paxil, kind of Effexor, Prozac, or kind of combinations of different medications increases your risk. If you're taking kind of like a Zoloft, those types of medications are less risk. And then I get a lot of questions from patients about what to do about sleep, because your pregnancy a lot of times can lead to a lot of challenges with insomnia. And I think the challenge with understanding what is safe in pregnancy can be really kind of complicated, because there's like all these letters and numbers and you're like, what does this all mean? In general, if this doxylamine or Unisom is the only medication in pregnancy that's actually category A, which means that studies have shown that it's safe and there's no harms to baby or mom. So that's kind of like the one available medication you can get over the counter that can help with sleep. And then any other medication really is going to be either, we don't have enough data to really know. And most medications when they come out in the market are going to be category B, because we don't have any data. We don't know if it's like doing much of anything. We don't have any data that it's harmful, but we also don't have a lot of data about much of anything. And medications may also stay in category B if we don't have any information that it's harmful. But we also, there could be, some risk, but it's not significant. And then C is when the category C and D is really when you're getting into, gosh, there may be some risks there. And then there's also a category X. You see over there's a category X you'd want to absolutely avoid, and your doctor will make sure that you're not taking anything that's in that category. And then I just wanted to highlight kind of the new parent support group here, and I hope, I was sorry to learn about the core kind of moving locations, and but I think this is a really great start, and to have this resource available is wonderful. And I know there are other postpartum, new parent support groups in town too, to check out. And it's really a really kind of vulnerable time, and just making sure that there are resources in the community, and making sure that you know what's available to you. And then let's see, I think that was all that I had in terms of slides. But I really appreciate everyone tuning in and being here, and I welcome any questions and comments or anything.
What can other people look out for, and how to help those who they think might be going through?
Yeah. So if you're thinking through some of the symptoms of that kind of postpartum period, and you're like, gosh, I don't know, is this a postpartum depression that I'm dealing with? Sometimes it can be hard to get that mom to seek help, but really that kind of postpartum visit, or even that pediatrician visit, can be a really good time. If you have that relationship where you can encourage them to kind of go to that visit and get that screening done. There's also assessment places in town. So Palo Verde has a walk-in. You can kind of come in for an assessment at any time. So everyone can kind of come there if you're concerned, especially if you're having suicidal thoughts. You want to make sure that you're getting evaluated and you're safe. And they're, and if you have a loved one that's dealing with suicidal thoughts, make sure, you call 911, go to the emergency room. And again, like Palo Verde does have an assessment. Tucson ER also has an assessment, behavioral health consultant on call.
There is a question online that says how to increase oxytocin levels during pregnancy.
Right. So there are some just like nutritional type of tools out there. And did you have a question specifically about nutrition, or just medications, or online question? Okay. Let me kind of come up with a list of some things, and I'll pass it on to the organizers, and they can get back to you about that. It's a good question. Thank you for sharing that. Thank you so much.